Today's topic, what we are going to discuss is the yoga for bronchial asthma and different respiratory disorders. Basically, before starting with the actual core practices which are helpful for the asthmatic person, let us just have a little background about the system, the respiratory system. So the basic function of the respiratory system is to conduct the exchange of the oxygen and the carbon dioxide in the body. We normally breathe for about 12 to 20 times per minute. As per the individual, the time, the frequency may vary. And as you know, the breathing is a dual process. It can go on its own, so it is an involuntary process, and it is also a process that you can consciously control. Unlike the heart rate or the digestion, which we cannot control, but breathing is something that is also in our own control also. So this is the basic structure, right from the nose, then the larynx and the pharynx, which are in the throat area, then the trachea, that is the windpipe, which is going into both the lungs through the bronchioles, and then there are small tubes which are the bronchi, and last one is the air sac. So you can see here this picture. This is the last part of the respiratory tract. If you see these small linings, also in that picture you can see the small linings. They are the supporting cartilage for the windpipe, for the tubes through which the wind is flowing. And why I am showing this, because this we will need to understand further when we understand what is asthma. And these are the last part, are like the balloon sort of the cells, जिसके अंदर अपना सांस वहाँ पे जा कर के, that is the place where the oxygen gets exchanged with the carbon dioxide. And you can see around these are like the mesh work, that is the capillaries. तो capillaries वहाँ पे आती है, वहाँ से oxygen और carbon dioxide का exchange हो जाता है. So this is basically the actual process that goes on in the breathing. Now, as you know that the main process is for the gas exchange. Second part, first kind of a respiration is happening in the lung, that is called as the external respiration, and second part is the internal respiration. So after the blood gets lot of oxygen from the lung, the blood goes into all over the body, goes to individual cell. There it will give away the oxygen and take up the carbon dioxide. That oxygen will be utilized by individual cells to generate more and more energy for the work. So energy is always in the form of ATP, right? This is what is happening. There are two types of the respiration, right? One is the external, one is the internal at the cell ka side pe, right? Now with the inhalation, how the inhalation happens? We just inhale like consciously when we are inhaling, or naturally when we are inhaling. So how exactly it goes on? So actually it is a process with two main kind of muscles. One is the diaphragm. Diaphragm is a muscle which is separating your chest area to your abdominal organs. So it is a like big dome shaped muscle, right? And that is pulling slowly down. वो नीचे की ओर खींचता है, तो क्या होगा, चेस्ट के अंदर जगह बढ़ेगी. There will be more space created, and there are the intercostal muscles around our ribs. हर एक जो छाती की पसलियाँ हैं, वहाँ पर छोटे छोटे मसल्स हैं. तो लेट मी गिव एन एग्जाम्पल. अगर आप बकेट को देखोगे, वो बकेट का हैंडल होता है. ओके, इफ यू लिफ्ट द हैंडल, what happens? If the handle is a little bit lifted up, it goes away. अगर वो अभी यहाँ पर है, अगर आपने ऐसे लिफ्ट किया तो वो हैंडल ऐसे करके ऊपर आता है, right? This is what is happening to all the ribs. When we are inhaling, when the intercostal muscles are contracting, they increase in size. The internal area will be also increased. So this is how, with two different function of the diaphragm and the intercostal muscles, the chest area inside gets more, and because of the negative pressure inside, outside air will flow inside. Okay. Now what will happen in the exhalation? It is a passive process. So वो जो खिंचाव होता है muscles के अंदर, that will be left. So naturally the air will be going out, because then internally there is more pressure. When the muscles leave all the contraction, it will be like the balloon kind of a pressure. So then the air will be flowing out, right? This is what will happen. Now during the gas exchange, the acid and base balance is always balanced in our body. So there should be a perfect pH maintained for the blood to be able to maintain the homeostasis. Homeostasis is a basic internal environment of the body. If there is any change in the homeostasis, then there is a problem. Like many of the people, they always feel little bit acidic, or they feel lot of heat, or sometimes they are feeling lot of skin kind of like a skin rash or some kind of a irritation. So that is because of the change in the basic blood chemistry. That can be also one of the reason. So the acid base balance is maintained with the help of the oxygen and the carbon dioxide exchange. So कई बार ऐसा होता है that there are so many other problems, and people say that because of practicing the yoga or especially the pranayama and all, so many different things are also changing, like their leg was paining from a long time, or they had some kind of a liver problem, but just with the pranayama how can it be cured? So this is one of the clue that may be the answer, that this is how the yoga practices also help, right? The next part is we will just see the functions of the basic areas. The nose is very important because it filters the air because of so many of the hairs. Then it warms up the air. It also dehumidifies. So there is a little bit dry air. So it will give little bit humidification to the internal air which is coming inside. Then it gives the sense of smell. And it also protects, because of the smelling sense. If there is very harmful gas, then we will know that we don't want to inhale it and get it inside our lungs. So this is the filtration process. Now, since we have looked at the nose and the functions, basic respiratory problem starts with the nasal allergy. Asthma is also starting from the nasal allergy part. Exactly what happens in there is a hypersensitivity. So our nose is having so many different kind of the receptors. It will also detect any kind of a smell. It will also detect that, oh, there is some kind of a dangerous chemical or dangerous some small substance which is going inside. So it will also detect and tell it to the brain. Now for you and me, or for any general person, they can smell a very nice kind of a flower and they can enjoy the smell. But for some people, if there is a little bit of small pollen inside the flower and if they smell, then they suddenly get this chronic kind of a hypersensitivity effect. So there are so many symptoms that will be seen. Like she has said that cough, immediately you will start coughing or you will start sneezing. These are the hypersensitivity effects that is in the individual. Not everybody will have the same kind of a hypersensitivity. Like we all have different varieties of our nature, our thinking. So like this also the hypersensitivity level is varying. And if the body feels that this is suitable and this is not suitable, if the not suitable thing goes inside, it will start with the reaction. What will be there? There will be something like the dust is there, pollen मतलब जो फूल के अंदर से आता है, परागरज. Then there is some kind of a bacteria, house dust or mites. All such things, they cause some kind of a sudden there is a chemical called as the histamine. Any kind of a allergy going on in the body, histamine will be the first kind of a chemical which will be triggered. So That will cause us sneezing, swelling in the whole tract and all these things. So what the doctors they do, they will give us the antihistaminic, any kind of the allergic condition. As soon as you take the antihistaminic, all the reactions which you can see on the skin are now stopped. But they are artificially stopped, as you know. Internally the body is still fighting because it doesn't like. So this is the area of the nose where there will be lot of reaction will be seen and will be felt when there is any kind of a facing of the allergens. What we will feel is the sneezing, nose will be watering, coughing, itching, eyes also will start watering and becoming red, then headache for some people, etc., etc. Right? These are the basic signs which we will feel. But normally when you go away from the allergens, all these signs should go off. If these are the signs along with the fever and other symptoms, then it is not only the respiratory system, it has also gone deep into the immune system problem, if the fever etc. is there. Okay. Now what causes such kind of a general allergies? One is the asthma. If there is a family history of asthma in the father, mother or grandparents, or if there is any kind of allergy to the food, allergy to the dust etc., or in the urban areas nowadays pollution will be the main one of the reason, right? Also pollen, dust mites, animal dangers, all the food items etc. will cause. Let me tell you, when we are talking about the food, one of the food item which is known to cause such thing is milk. For some people, milk and milk products they cause. For some people, the nuts, any kind of the nuts, the peanuts, coconut, any kind of a nut may cause. So one simple way that you can try, if you are having the asthmatic problem and if you don't come to know what is the reason, then what we can do, we can try and eliminate one thing for one week or 3-4 days or like this. Supposing the peanuts, you completely avoid in any way the peanut and you see what is the effect. If your asthma problem, if it is seen on a regular basis and during that time if it will stop, then we can confirm that maybe it is because of the peanut. Then next week you can try with the milk. So on, you can try with different products and then you can find out that this particular product is somehow not suitable to my system. Now let us come to the asthma. As we have seen, the nasal allergy was starting with the hypersensitivity. Okay, similar way asthma, hypersensitivity. Sensitivity is the ability to sense something, and hypersensitivity is the over kind of a reactivity of our system.
It's an exaggerated response.
It is an exaggerated response. So if a normal person, as I told you on example, if they will smell the flower, there will be no problem. But an asthmatic person, if he is having allergy to the pollen, then he will immediately respond very fast. Like we have sometimes in the people also we see. Some people are very much quiet. You tell them anything, they will take it in such a way that they are quiet and nicely, giving you the response. But some people, even a little bit kind of a disturbance in their environment, they will trigger off so fast. This is our mental part, which also is very important in the asthma part. To be able to cure it more effectively, this kind of a nature will also be counted, that such people have more problems, right? So asthma part, if we see, the bronchospasm, broncho is the airway, जहाँ से air अंदर जाती है. The main, that trachea and the bronchus and the entire tree, it is called as the bronchial tree. So spasm is the constriction. What will exactly happen, that you can see, this is the normal our bronchial area through which the air which is passing. When there is any kind of exposure to the pollen or any kind of allergens, then there will be a spasm. Spasm matlab constriction. So as soon as there is a constriction, the airway area will be less. So naturally you can understand the air which is going inside will have less space to go inside. Okay. So first reaction will be the constriction. Second reaction will be the mucus release. So the mucus from the around area, mucus is like the slimy structure, like a sticky structure which is there in the body, but it is in a way helpful. Why it is helpful? It is meant to protect, to lubricate, to wet, to keep that area in a like a wet way. But when it is overproduction, then it is harmful because we cannot breathe properly. So this is exactly what is happening when the attack is there. It is normally a kind of a reversible attack. Means if you are going away from the allergy or the substance, then you come back to the normal state. But for some people, they are so much hypersensitive that goes on. Even a little bit change here and there is a very, very quick effect. What will be there? First I told, it is the inflammation. Second is the airway muscles, all around the muscles are tightening. Okay. Third is the fluid, that is the mucus, which will be always, that will also clog the channel. There will be no space for the breathing to move. So what are the causes? Doctors say that there is not a particular known cause that is found in all the people. Okay, it is somehow still the cause is unknown, but still there are some things that are sure, that are seen. One is the family history. If there is a family somebody have, then one has to be very careful that they have a possibility to have the asthma more than any other person. Then there is a hypersensitivity of the bronchus for some people. This is one of the cause. Then there is a weakness in the lungs, or any kind of a lung infection or any kind of the viral infection is also one of the cause to get asthma, right? Which are the factors? As we have seen, the indoor and outdoor dust etc., cockroach का जो भी रहता है, allergens, or it can be any kind of infections, or sometimes the psychological factors. As I have told you that some people are really fast in the kind of short-tempered sort of. So for them also asthma is a very possible thing. If they are not able to control, later in their stage, if the lungs get weak, they might face the asthma problem. Even the exercise, if they are doing too much of exercise, that can also be one of the factor that may cause asthma. Also the occupation related. For some people like the traffic police, we are giving lot of training of yoga to the traffic police also, because they are always standing in amongst the traffic and just inhaling the all that pollution, carbon monoxide, carbon dioxide, all the, even the pollution areas, the strong odors are also one of the factor that will trigger. Odor matlab smell, very, very strong smell.
You're sitting in a box of papers and also there is some
Lot of
old
papers.
That smell.
Yeah.
Also breathing also.
Yeah. For some people, like the occupation hazard, the lawyers or somebody those who are always surrounded with lot of files and papers and all, they will always be exposed to some, if there is a duck करके वो थोड़ा सा वो फाइल रखेंगे तो उसमें से जो थोड़ा थोड़ा डस्ट निकलेगा, minute dust, that will also cause the problem, right? Then there is a acidity. If the acid burn is there, it will come up and cause the irritation to the chest area. That will also may sometimes cause the acidity or this asthma effect. And there are many other factors also. Even the diet, as I told you, is one of the main factors. Now the symptoms, as you might be knowing, one is the sneezing and coughing, one is the mood change, headache, running nose, chin और throat irritation and itching. ऐसे पूरे अंदर itching जैसा होता है. dark circles around the eyes. That is normally because of the tiredness and the low amount of oxygen, right? Then there is a trouble in the sleeping, because when the breathing is having kind of a problem, the person may not be able to lie down. They will have to always sit. So whole night people are sitting when they are having the asthma problem on. That is one of the main problem. Then there is a very much poor tolerance to the exercise or even walking. They cannot walk properly. Or in the severe condition, there are breathlessness, hunched shoulders. ऐसे करके एकदम, when there is ongoing asthma for a very very long time, shoulders are also hunched. Then they feel even the difficulty in the talking. All this problem will be there. There are some types of asthma depending on the origin or the cause of the asthma. Now, how is asthma diagnosed by the normal medical doctors? They take the medical history, right? They do some physical examination. There are some lung function tests where the person is allowed to blow, to inhale through the machines, and then they come to know what is the condition of the lung, right? What is the modern treatment? There are some inhalers which are metered dose inhalers. There are some nebulizers. Nebulizers is the machine with the tube. So when there is an asthma attack, the nebulizer helps to do the bronchodilation. What are the limitations now? At present, if the allopathic medicines are consumed, the limitations that are seen, one is the root problem. The root cause is not cured. The root cause, as we know, is the hypersensitivity. That is not still addressed with the medicines. Okay. The long-term effect of the steroid is also very harmful. Any kind of asthma problem, steroid is one of the main medicines which will be used. So a long-term use will be definitely harmful. The ability to cope with the psychological part is still not there in the medicines. As you see, the hyper person will get such problem more fast. So there is no option in the medical science to deal with the psychological part yet. There is no possibility of preventing the attack. Okay, once you have the attack, okay, you take the inhaler or the nebulizer and it will help. So such things are there. Now what is the concept of yoga? Yoga understands that every being, every individual is having 5 layers of being. One is the physical aspect, that is the Annamaya Kosh. Then is the breathing aspect, that is the Pranamaya Kosh. Then is the mental aspect, that is the Manomaya Kosh. Then is the intellectual aspect, that is the Vijnanmaya Kosh. And then there is something which is a blissful aspect, that is the Anandamaya Kosh. We all exist at 5 different levels. Okay, and if we are in a healthy state, these 5 levels are in a balanced state. But if there is any kind of a disturbance at these 5 levels, then there will be surely a problem in our physical body. So in any kind of a disease, how yoga understands the disease, it is very interesting for you to know that any kind of a disease, yoga says that some are originating from the body. They are approximately 10% of overall all the diseases. Like if you have come across any kind of infection, okay, or if you have got hurt by the trauma, there is inevitably, because of the infection or some kind of a disease, you will get some problem. For that, medicines are there. But many of the problem, they normally start from the mind part, from the psychological part. So why does this part is there? Some time back when I had a lecture, I was explaining, basically we have got 2 types of the nervous system. One is the sympathetic and one is the parasympathetic. Okay, these both are the autonomic nervous system. They are on, they are working automatically. Now if we are sitting over here and if there is a fire alarm, we all will suddenly start getting up, we will start going down and go out of the building. But right now if you see, your state of being is very much kind of a relaxed. Some of you are maybe in a little bit kind of a sleepy mood also. But if there is an alarm, all the sleep goes somewhere all the tiredness, everything goes off. You suddenly become awake. You get all that energy. How that comes? That is because of our sympathetic nervous system that gets us active and alert. Okay, this is exactly the system which is triggered in a very much low concentration when you are facing any kind of a stressful situation. Okay, so the effect on overall all the system will be similar, that your blood pressure will be rising, blood sugar will be rising, muscles will be little contracted, eyes will be wide open, breathing will be more fast, heart will be pumping very much fast and strongly. All these symptoms will be there in a minute form in any kind of a stressful situation. Now you come back to asthma. There is a response or the hypersensitivity of the bronchial tract. If you are facing any kind of allergens, that same sympathetic nervous system will be triggered. So the same functions will be there, right? So it will have the same effect of the triggering. So the person will be having more of the activity or the alertness, but it is actually harmful if it is staying for a longer period all the time. So if we understand that why it is psychological more, nowadays less people die of supposedly TB or dengue or such things where the infection is there, but more and more people are dying because of cancer, heart attack, blood pressure, diabetes, etc. Because they are all psychological. They are all created by our own. We are the creator and we are the main cause for these all disorders. Our mind is the cause. So yoga, when it is about the asthma, the main role of yoga will be to bring down the spasm in the bronchial tubes. The spasm, that is the constriction, to increase it again back to the normal and to help in the clearing of the pathways of the channels of the breathing through different asanas, pranayams and kriyas. Let us now come to the actual practices. First part, we'll just see some of the theoretical aspect first, or some of the aspect that we cannot do right now over here, but still you will come to know what are helpful part. One is the jalaneti. Now what is the meaning of kriya? Kriya is to do something, right? In Hindi, kriya matlab kuch to karna hai. There are 6 kriyas in yoga which are very helpful and important to do any kind of a cleansing in the body, to clean. Okay, first one is the jalaneti. Okay, neti is the first one. उसके अंदर क्या होता है? There is a saline water. Saline मतलब थोड़ा सा उसके अंदर salt रहता है. That saline water, because our body mechanism is also having that particular pH. So you need to have that perfect same kind of a environment with the water also and the internal body also. That is why we put little saline. We put little salt. And that salt with a particular tube वाला एक ये रहता है, उसका pot रहता है. Through that pot, it is poured into one nose. It passes through the septum, comes out through the other nose and goes out. This is continued for some time. It is a lukewarm water. So it cleanses all these nasal areas, and there is a hypersensitivity. So all these cells are always sensitive. They need to be desensitized. They need to be trained. Okay. Let me give you one example how this thing works. If the pet dog is there, people send it for training. Okay. If you don't train the dog, it will be a wild dog. It means it will behave very much odd. If anything is there, anyone is there, it may bite, it may do anything. But if it is a trained dog, like our child, they also need a lot of training. So the training will help them to nurture, to have a particular way of the reaction. Same thing will happen with the kriya when we are training the nasal cells to react less to any kind of allergens. They will get trained over a period of time and the reactivity will be lesser. Okay. So with the salt water, this practice will train our system. Next one is the sutra neti or the rubber neti. In the earlier one we used to pour the salt water. Now there is a thin catheter like a rubber tube that is inserted through the nose. It is passing and it will come out through the mouth, and then it is a particular type of action is done. That is also training the nasal area to be able to face that much of the allergens. Okay, there are some points in our palms. Let us start with little practical thing right now. Let us just keep the palms like this. All the fingers and the thumb is touching. Bang it. जोर से 15-20 times more. Okay. Okay, relax. Now you just keep your palms little close and little away. Take it little far, bring it little close, move it round. Again, bring it close and far. Can you feel something between the palms? Like the magnet is there. You are holding a magnet, positive, negative pole. That kind of effect comes. That comes because of activation of the iron in our body. The iron gets converted into the magnetism, uska through active ho jata hai. So you feel this polarity. Okay, this was just to wake you up. Let us continue now. So I was telling, I want to share one practical like an experience. I was studying the science of yoga in Bangalore. There is a world level yoga therapy. It's a university which is dedicated to the research in the yoga therapy. That is right from certificate to the degree, post-graduation, PhD in yoga is all done over there. And there is a research going on. And Bangalore is a place where there are a lot of gardens, lot of gardens all across the city. So a lot of people are there naturally having the lung problem with the pollen allergies too much. They are all sneezing, coughing, lot of time that is there 12 months, all the time, all over the year. The breathing problem is there with them. So many people come to this yoga university for the breathing problem. What main part of the therapy they have is the kriyas. Okay, one of the kriyas we saw, that is the Jalaneti. This you can once learn properly from an expert yoga teacher, and then you can practice at home. Second part is the Sutraneti. That is also very easy. It needs some guts and confidence. So actually this practice, if it is done properly, it will increase the confidence in you. Sometimes we are so much afraid of small things, that is also causing our psychological feeling that we cannot face the problem. Once you do these practices, your confidence, fear factor, everything will be changed, right? So these all people feel lot of change when they do this on a regular basis, right? Even the Kriya of Kapalabhati. Now Kapalabhati is technically a Kriya. It is helping to clean, right? You all know Kapalabhati nowadays, people all know that it is a process of exhaling in a particular manner. How you do it? You sit properly, right? Without eating for some time, and then you are doing this forceful exhalations with a stroke. You have to maintain one speed from starting to end and just concentrate on the exhalation, not inhalation. Just exhale with a force, with a stroke, and that goes on. Exhale करना है. उससे क्या होता है? जरा आप 2-5 बार करके देखिए. What exactly happens? यहाँ से लेकर के नाक के एंट्री तक का सारा एरिया में से air goes out in a fast movement, right? So any kind of a small dust, particle, gas, anything is there that goes out. It is cleansing. Secondly, lot of gas exchange happens. So when you are doing this on and on, then a lot of carbon dioxide also is exchanged with fresh air, fresh oxygen, right? This is also Kriya to cleanse, and it will also give psychological effect. You will see that maybe about normally Kapalabhati, how we do in a proper manner, if you want to see, you start with the Kapalabhati you continue till 60 strokes or 80 strokes or 100 strokes. Okay, so once you start, in the beginning, I don't know who आप कितने टाइम से ये सब प्रैक्टिस कर रहे हो, but for the beginners 60 strokes for 1 minute. That means you have to imagine the clock, sound of the clock hand, tick, tick, tick. That should be the speed of your strokes. So 60 strokes in 1 minute, then you stop. Stop for half minute or 1 minute till the breathing is coming back to the normal level. Again continue for 60, again stop. Again continue for third round of 60, again stop. For 1 minute in between you have to stop also. Right? This is the correct method. Don't go on continuously for 5 minutes, 10 minutes, whatever. Okay, it may be dangerous for the beginner. So 2 or 3 or 4 rounds of 60 or 80 is very good. For a couple of weeks you have to continue with the same. Then after taking the advice from an expert, any of the yoga teacher, then you can continue with the further steps. Maybe you can increase the number of rounds also and the number of strokes also. And the speed also can be increased. 1 minute right now 60, then you can bring it to 80, 100, 120, so on. But generally Kapalabhati is a process not to be done more than 300, 400 times maximum. Right? Let us continue with the next very, very effective Kriya, that is the Vamana Dhauti. Vamana as the word is there, it means to bring out, to vomit out. तो इसके अंदर क्या होता है? This is done on an empty stomach in the morning. Person drinks that same saline water, 2, 3, 4, 5 glasses, till he feels full till here. Like you sometimes say, I am full till the neck. वहाँ तक पीना है और फिर आगे झुक करके आप थोड़ा सा उंगली डाल करके इरिटेट करेंगे, then the vomiting will come out. That will bring out lot of mucus, lot of all the acidic part from the stomach, and immediately there will be a relief in the signs of acidity. So the patients of acidity are also very much helped. Asthmatic people get lot of relief in all the symptoms, because this also decreases the mucus concentration in the lung. उसको भी बाहर निकाल देता है. Bronchial asthma के लिए Vaman Dhauti is also very, very helpful. But this also you need to learn from a yoga teacher to be able to practice at home. Once you learn, you can do it once in a week. Once in a week is also very effective. Or once in 3-4 days is also good. And it is not having too much of a side effect once you learn it properly. Okay?
What side effect it has? It should not have any side effect.
It should not have any side effects. See, once we are learning anything properly and we know the correct method, when to stop, how to do, then you can perform it on a very, very much proper base. Those who are having a lot of problem with the circulation or the heart problem and all, they of course will not be able to do this practice. But all the others, this is very, very nice practice. Daily no. Once a week or once in 3-4 days. Second practice, see, this is a Danda Dhauti. वो था Vamana Dhauti. Right? Danda Dhauti में क्या होता है? The same kind of a big catheter is there, rubber catheter. वो वाला ट्यूब को धीरे धीरे वो लोग निगलते हैं. You swallow the tube. It is that long. उसको इतना सा बाहर रखना होता है. Rest of it you have to swallow it till it comes to the starting of the stomach.
1 liter?
It is about 2.5 feet approximately.
1 liter.
So it will just enter the stomach area, this thing, and then you drink the water before itself, and then you go down and all the water like a suction effect will be coming out. You can see the person is there and the water is down on the ground, you can see. So it will be flowing out. Like the pipe from the tank. You put one pipe up, you put the level down and the water will be flowing out. Like that the impurities or the acidic or the irritants will be flowing out. This also is very helpful because it will train our internal area for the allergens. This is a Vastra Dhauti. This is also one of the process which is very helpful for asthma. उसके अंदर पतला सा कपड़ा रहता है, मुलायम सा, उसको धीरे 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 करके उसको निगलते हैं. ओके, इट गोज इनसाइड द स्टमक. इतना सा बाहर रखना है, पूरा नहीं खा लेना है. उतना सा रख के बाद में आफ्टर सम टाइम यू पुल इट आउट स्लोली स्लोली. So all that irritants will also be coming out, the impurities. You can see the sticky, some food particles, some bile sticking to the cloth. हाँ हाँ, ये तो काफ़ी बहुत लंबा होता है, quite long, 3 meters approximate.
पानी पीना पड़ता है.
So अभी जो मैं आपको समझा रहा हूँ, हाँ, right. So अभी जो मैं समझा रहा हूँ, it is in short for you to understand the process, right? Just this much explanation may not be enough for you to be able to do the practice, right? So ये भाई साहब इसको निगल रहे हैं, then it is to be slowly brought out again. Okay. Now Shankha Prakshalan is a wonderful practice. I call this as a Diwali cleaning of the body. Diwali cleaning. Shankha Prakshalan में क्या होता है? The name suggests Shankha is the conch. It is having the incentric circle, right? Prakshalan is a cleaning. तो जो हमारे इंटेस्टाइन एरिया है वो पूरा ऐसे ऐसे गोल 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 है. दैट इज वॉज द कॉन्सेप्ट इन द माइंड ऑफ द ऋषिज, दोज वेर इन्वेंटिंग दिस. उसमें भी सलाइन वाटर पीते हैं. फिर सेट ऑफ एक्सरसाइज, ऑल दिस एक्सरसाइज आर डन. देयर आर 5 एक्सरसाइजेस. Again they drink the saline water, again they do the practice, again saline water, again do the practice. Then you start having motion in between. Drink the water, do the exercise, go to the motion, drink the water, do the exercise, go to the motion. That goes on.
Then 6 things you have to do at a time?
That goes on.
Then all 6 are you do at a time?
What 6?
6 exercises?
Yes. At a time means we just finish one practice.
I'm talking of the Jalputi and
हाँ, ना.
same that.
Separate.
One that this, one that.
हाँ, the Jalaneti, Sutraneti and the Vamana Dhauti, that you can do in one day.
Okay.
This is a Diwali cleansing. This you don't do every day cleansing of the Diwali. रोज तो नहीं होता है, तो ये कभी कभी करने का है. ये दिन और कुछ नहीं करना है, राइट? और ये सब करने के बाद में you start getting the motion like the water you are drinking. That much clear motion will come. उतना तक पूरा cleansing होता है. It takes about 2.5 to 3 hours, and you have to do this in the presence of an expert, so that you can be guided properly when to stop. उतना आपको clear motion आना शुरू होगा, then you have to stop the practice, rest for some time and have the khichdi with the ghee on that day. Okay, this is a process which is very effective even for a healthy person. Okay, see, this is the beauty of the yoga and Ayurveda and etc.
इसमें भी salt water पी के करने का.
Salt water, slight saline water होता है.
पीने का.
नहीं, वो आपको 2 ग्लास पीना है, बस 2 ग्लास पी करके एक्सरसाइज करना है, वापस 2 ग्लास पीना है, वापस एक्सरसाइज करना है, वापस 2 ग्लास पीना है. People have drank up to 40 glasses. Keep on going for the motion. Yeah. So
Once a month, fortnight or once a week?
no. Diwali cleansing is once 3 months. So, but it is very helpful. As I was saying, that yoga and Ayurveda have a lot to offer for the healthy person also. If you go to any allopathic doctor and say, I am perfectly healthy, okay, now tell me something that I can maintain my health. He will be mum, because normally they don't have anything. You have to have disease to be able to treat it. Okay, but here you have something that will help you to prevent. Okay, then this is some of the techniques which are the best, and they have been surviving from 2000 or 4000 or 5000 years now. So it is not that I have invented or some people have invented 50 or 100 years back. They have been practiced from ages, from families, from generations. So there is no point of having any fear or doubt. They will work. We have to know the proper method, how to do it, and it is giving very good effect. Okay. Even Tratak is a cleansing process. Cleansing for the eyes, cleansing for your mind also. Right? Now let us come to the practices. अभी हम लोग फटाफट कुछ practices देखते हैं which will be very helpful for the respiratory system in general. So let us all keep some things aside because आसनों के सामने देख के कुछ benefit नहीं होता है, हम जब भी करते हैं तो benefit होता है. So let us all come up to the standing position. If there is a possibility कि आप पैर के जूते निकाल सकते हैं, चप्पल जूते उसको निकाल के रख देंगे. Little come inside. Right. Okay. So let us interlock the fingers. Turn the palm down. From here we will come up on our tip of the toes. Inhale and bring the arms up. Come up on the tip of the toes. Let the palms face up. Pull up. From the side, bring your arms down. Exhale and come down. Okay? Again interlock. Face the palms down. Inhale and come up. सांस गहरा अंदर लीजिए और ऊपर आइए. Pull up. Come up on the tip of your toes. पूरे छाती फेफड़े को खोलना है ऊपर की ओर. And then exhale, 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 come down. See, when you come up, those bucket handles you imagine, they will be raised up, all these ribs. So again, last time, interlock the fingers, face down, inhale and come up. Pull up. Now to check if this asana is correct, what to do? Just see if your abdomen is going inside. Automatically it will be inside right now. Pull up. There will be little space created in the ribs. And then exhale. Now see your breathing. Little easy breathing because the space is now created little more. This is the Tadasana. This is the initial standing position and then you go with the arms up. This is now the relaxation posture. Just relax. Keep your hands hanging next to you. Stand comfortably for 2-3 breaths. This is the sitting position. This is the relaxation in the sitting. This is the lying down position. This is the relaxation in the lying down. Okay? This is the relaxation in the lying down. Seedha. Now, let us come to the next practice. First, what we did was called as Tadasana. Tad matlab that palm tree. Now we do sectional breathing. Okay, hand stretch breathing. There are 3 lobes in the lung. Lower lobe, middle lobe and upper lobe. So you interlock the fingers. Keep it in front of your chest. Elbows and shoulders are dropped. इसको ढीला छोड़ देना है. Elbows and shoulders. Now you do the lower lobe breathing. Lower lobe breathing में क्या करेंगे? Inhale, bring the arms straight. Inhale करते हुए सांस अंदर लीजिए, सांस बाहर लीजिए. Relax the elbows and the shoulders. Okay, again inhale. Inhale through the nose. Exhale, relax. Okay, don't do it any tension. Be very much relaxed. Inhale last time. And exhale, bring it back to the chest and relax. Now we do the middle lobe breathing. थोड़ा ऊपर जाएंगे. Inhale and bring the arms above the forehead. Above the forehead थोड़ा और ऊपर. Exhale down. Inhale. Feel the change in the breathing compared to the first level. थोड़ा आपको ऊपर फील होगा लंग्स के अंदर. और एक बार करके देखिए. You can even आप अपनी आँख को भी थोड़ी सी बंद रख सकते हैं. Keep your eyes closed for some time. Inhale last time and exhale out. अभी टॉप लेवल करेंगे. थर्ड यहाँ पे ऊपर की ओर आपको फील होगा. इंटरलॉक द फिंगर्स. Continue to go up. Inhale up above the head. Don't come up on the toes. Just stand as you are. Exhale, come down. Again, elbows and shoulders are relaxed all the time. Again, inhale second time. Feel now it is more up in the chest compared to the first. Exhale, come down. Last time. Inhale, go up. Feel the air is going in top part of the lung. Exhale, come down. Right. You can feel the difference तीनों के अंदर, right? This is the way that your lungs will get expansion training, right? Let us come to the next pose. See, this is the 135-degree angle. This is the top angle what we did. Now the next pose is hands in and out breathing. Hands will be in front. This is hands in. पैर साथ में रहेंगे पास में. Now we will inhale and bring the arms to the side. Inhale, come up. Exhale, वापस. ऐसे करने से छाती और भी चौड़ी खुलती है. Inhale, exhale. Continue. Inhale, expand. Inhale, exhale. Last one more time. Inhale. और सांस बाहर छोड़ दीजिए. Very good. And relax. ये भी करने से क्या होता है? Overall lung capacity, the space is also increasing. Sometimes the muscles are so much tight, all the time sitting, not doing anything. Muscles are also in a very much dull state. When you push them, pull them, all these muscles are also getting the training to extend. Also, the lungs are also getting extended for more air to come in. इससे क्या होता है? This is a horizontal expansion. What you did first, Tadasana, is the vertical expansion, right? Let us come, see, this is the Tadasana, what we did. We did with the interlock hands so that you feel little more support. You can also do it with the palms separate. Let us come to the next pose, that is the tiger stretch breathing. Can you all sit down? Those who can sit down, just try to come down on 4. On 4. क्या करेंगे? You can just look at the picture first. First level, this is the inhalation where face is up, chest is curving down. Okay? This is the exhalation. Head will go inside and chest and back will be lifted up. Again inhale, again exhale. Again inhale and exhale. This is very, very good therapy for the back problem and for the breathing problem as well. Let us try. Okay, keep your hands little away from each other. Keep your knees separate from each other. Okay, let us start. Inhale, look up. Press your lungs and chest down. Now exhale, look to your stomach. Lift up your lungs and the chest up. Very good. Again, inhale. And exhale, lift up the back, up, 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 up. Again inhale, your spine should get curved down. Exhale, lift it up, up. Keep the full palm down. Inhale, last 2 times. Exhale, last inhale. Okay, exhale. Okay, let us slowly come up to the sitting position. Sit up. For those who cannot come down on the ground, you can do this same practice on the bed. Okay, on the bed, because it is little soft for your knees and you need not come down to the floor. It is very important that this practice should be done on a daily basis. First thing, it has got both the curves for the spine, okay, in and out. I have devised one more practice for those who are having problem doing even the going down on the floor. Imagine that you are in the center of a clock, okay, in front of you is 12. Behind you is what time? You are the center of the clock. Front is 12. Behind is 6. On your right side is 3. On your right side is 3. On your left side is 9. You are the center. This is the hand of the clock. Okay. Let us come sit in the front of the chair. Okay. You don't bring your chair in front. You sit in the edge of the chair. Okay. Now keep your hands on the knees. This is the hand of the clock, and you bring the hand of the clock to 12. 12. Curve your chest and back front. Now take it behind. 6. Curve back. Curve back. Hands on the knees, okay? 12 again. 12. See, my chest is actually coming in front. 4-5 inch आगे आ जाता है chest. Now take it back. Take it back. Take it back. Take it back. Yes. Now in front. Inhale. Let us join the breathing now. Inhale. See the chest coming out. Go in. Go in. Go in. Exhale. Curve it back. Actually, you should feel the curving. Last time. Inhale. Push the chest in front. Okay? And last time. Behind. Curve it back. Curve it back. You should actually push your spine out of your body as if from behind. इतना पीछे तक लेके जाए. Okay? Come back. Relax. Okay? See, it is not this 12 and 6. It is this 12 and 6 for the chest. Very important.
Neck will remain stiff.
Huh?
Neck, I say.